Hi there everyone, it's Ryan here again, and today we're going to be moving on with our section for the spine. So we've done tests on the upper cervical, mid to lower cervical, thoracic, and now we're going to finish it up by checking out the lumbar. So for the lumbar spine, we are doing active range of motion. We're going to be looking at flexion, extension, lateral flexion, and rotation. And we're going to be making sure that this movement is coming from the lower spine. Remember, it's important to compare our results for active range of motion to see what they're capable of and to see how it forms when we take them into motion, such as passive range of motion. However, for this test, we'll only be using active range of motion. So for flexion, let's begin. So Brian, can you go and bend down to touch your toes? Great, and any changes?
No.
All right, and relax. So for this, I want to cue him to make sure that I see the order of his vertebra going down as he flexes. So we're going to try that one more time, but this time I'll tell him to cue for that. So Brian, can you go and touch your toes, but this time tuck in your chin and let the rest of your back fall, starting from the top to the bottom. Perfect. Any changes?
No.
All right, so for this, we're going to be applying a little bit of overpressure. So to do this, we're going to be using our forearm on both sides, and we're going to squeeze in to allow for a little bit of extra flexion. And relax, Brian. Any changes with that?
No.
Great. So this time, Brian, we're going to be working with extension. So can you go and bend your back as far as you can? Notice Brian has a little bit of a limited motion over here, but that's all right, as long as there's no pain. Brian, how does it feel? All right, so we're going to be applying overpressure. We're going to stabilize his back over here and push down on him. Any changes? All right, and relax. This next one that we're going to be doing is lateral flexion. So for this one, Brian, can you take one of your hands and can you slide it all the way down towards my side? Perfect. Any changes?
No.
Great. So once again, overpressure, stabilizing at the hip over here, and applying more pressure from the shoulder. Any changes? No. And relax. Same thing on the other side. Brian, if you could tip to the other side. Perfect. Once again, we're going to be applying overpressure. Any changes, Brian? Stabilizing the hip and applying pressure from above. Any changes? And relax. So this last one we're going to be doing is rotation. So for this one, I'm going to ask Brian to please put your hands across your chest, and can you turn from your back, from this part of your body towards me? Perfect. So notice that there is a little bit of hip motion with Brian. So to stabilize this, I'm actually going to use my own body to block him. And we're going to try that again. So Brian, can you relax? One more time. Can you go and turn towards me? Perfect. To apply overpressure, we're going to stabilize him here and apply pressure in the turn. Any changes? All right. Any changes now? No. Perfect. Same thing on the other side. So we're going to stabilize him at the hip. Brian, could you turn towards me? Perfect. Stabilize him here and turning at the shoulder. Any changes?
No.
Perfect. And relax. So that's it for this test. See you again soon. So, catch you later. Bye. Hi everyone, Ryan here again, and this time we're going to be looking for aberrant motions of lumbar flexion, otherwise known as unusual motions. So what we're looking for is any compensatory motions that Brian might be doing as he's performing flexion or a forward bend. So Brian, can I have you bend down and touch your toes for me? And come back up. Perfect. So some compensatory motions that we're going to be looking at is reversal of lumbopelvic rhythm. Normally, during lumbopelvic rhythm, we're going to be seeing his trunk move first and then his pelvis. Brian did just that, so we did not see the reversal, in which case the pelvis would move first, followed by the trunk. Next up, we have what is called Gower sign, and this is where he might be using his hands to walk himself back up. Another compensatory method. Lastly, we might be seeing instability catch, and in this one, he might have a slight hesitation due to some pain. Brian didn't show any of these signs, so he's looking all right, and his motion for flexion is looking okay. That's it for now. I'll see you guys later, and that's it. Bye. Hi there, everyone. This is Ryan again, and today we're going to go and check out some lateral flexion, and extension via dual inclinometer. Now, dual inclinometers we use to actually create a quantified value for our measurements, and therefore we can go and compare them to what we expect for expected measurements as well as pre and post treatment. So we're going to need 2 inclinometers to separate the lumbar from the sacroiliac joint on how much motion we actually see. So first off, I need to go and find Brian's S2 and T12. So S2 we can find by first looking for his PSIS and moving inward, and T12 we can go and move in from his 12th rib and move inward. We have them marked for easier measurements, so we can go and perform the test. The first test we're going to be doing with the inclinometer is flexion. So for this, we want the center of the 2 pieces to be over the dots that we had made, zeroing out his measurements. And now we can check for how far he can move. So Brian, can you go and touch your toes for me? Perfect. And come back. Next up, Brian, can you go and lean back for me as far as you can? Perfect. And relax. So we're going to go and use the differences between the 2 inclinometers to find out his true value of where it comes from his lumbar spine. Lastly, we're going to be doing lateral flexion, so we need to change the position of our dual inclinometers. Once again, prior to measuring, we need to zero it out. And Brian, can you lean towards the treadmills? Great, and relax. And can you lean away from them? Perfect, and relax. So, using these 2 different values, we're going to find the difference between them and see what this gives us for our measurement, and that'll give us a quantified value for their active range of motion. That's it for now. I'll see you guys later. So, see you. Hi there, everyone. It's Ryan here again. And this time, we're going to be taking another test to look for lumbar flexion. So this time, we're going to be doing what's called the Gillette's test. Originally, this test was used to go and measure out SI motion. However, we found that in more recent studies, it's not as reliable as it was once thought out to be. However, it is still used to go and check out for the rhythm of walking. So, to perform this test, I'm going to be getting down low to my patient, and I'm going to be checking for PSIS. Now we can go and start up at their iliac crest and move inferiorly and check to see where his dimples are. So here they are right here. And one of our thumbs is going to slide on over to his spine on the S2 vertebra. Now for this, I'm going to ask Brian to walk as if he's marching. So Brian, can you step up as if you're marching with your left leg? One more time. Perfect. So what we're looking for is the thumb that is on his PSIS should move inferiorly as his pelvis rotates posteriorly. We're going to be checking for both sides to make sure that there's symmetry. So we'll slide over onto the S2 joint, as well as putting my hand on the opposite PSIS. So Brian, can you go and march again? time. Great. So my thumbs are moving posteriorly just as it has been shown, and we see some symmetry in motion. However, there is some balance and stability that Brian is working on, so before we go into the march. So we'd like to go and look deeper into that and see if this has anything to do with muscle activation or weakness. That's it for now, so we'll catch you next time. Bye. And this time we're going to be working on another lumbar test. This time it's called the standing flexion test. For this test, what we are going to be watching is the way that the PSIS move as Brian goes down for flexion. So for here, I'm going to need to come down to his PSIS. Once again, we're going to be looking for it, starting at the iliac crest, moving medially and inferiorly until we have both of them. We're going to be checking for symmetry over here as well as symmetry during his motion. So Brian, can you bend down to touch your toes? And come back up. Perfect. So what we're looking for is to make sure that as he goes down, our thumbs are moving superiorly as his pelvis rotates anteriorly. Exactly opposite of what we had done in the Gillette's test. We saw symmetry of motion with Brian, so he seems to have A-OK motion with that. That's it for now, so I'll see you guys next time. Bye. Hi everyone, this is Brian again, and this time we're going to be doing what's called the side-lying hip abduction test. What we're going to be checking is for symmetrical motion between his hip abductors for both of his sides, and we're going to be seeing if there's stability in there. So first of all, I want him side-lying as he is right now, but we want to make sure that he is completely straight as much as possible. So we'll ask the patient to have their legs stacked up as such. We'll have them have their hand on the rib cage, and then we're going to have to straighten them up as best as we can. All right, and are you relaxed in this position, Brian?
Oh yeah, I feel like I'm going to fall, but it's okay.
All right, so for this, we're going to have to cue our patient through the motion. So what I'm looking for is an abduction. So Brian, I'm going to show you this motion, and I want you to repeat it by yourself, all right? So it'll be something like this, something like this.
Okay.
Is that all right?
Yes.
All right, so let's take a look from over here. If you could do that for me, Brian. And one more time. Can you do it for me, Brian? All right, perfect. So when we are doing the side-lying abduction test, we are grading it. Brian did a pretty good job with his. There was just a little bit of wobble. 0 is a score for no wobble during this. 1, a little bit. 2, moderate. And 3 is where we really start to see some great instability. So we would want to check further, and we can assume that there might be weakness in glute med for this. However, for the most part, he did great. So that's it for now. I'll catch you later. So see you. Bye. Hi there, everyone. This is Ryan. And so now we're going to be checking out the motion of each of his lumbar vertebrae, just as we had done in the past with his thoracic spine and the spring test. Now we are performing the lumbar spring test. So to do this, we're going to go and use our hypothenar eminence right over here. And we're going to be pressing down, transmitting force through the palm of it onto his spinous processes. So first, we need to look for L5. We can do that by first finding his iliac crest and coming down into the median. This first vertebra that we hit right here is going to be L5. So it's important that when we're performing this, we're applying pressure as vertically as possible so that we don't hurt ourselves in the future. So I'm going to be looking for 5 vertebrae as I move my way up from L5 to L1. When I'm doing this, I'm looking for the quality of springiness or elasticity that comes back to my hand. And in doing so, I'm looking for if there's a normal, hypomobile, or hypermobile motion. So that's it for now. Brian did a great job, so I'll see you guys later. See you. Bye. Hi guys, this is Brian, and we're going to be finishing up with our last test for the evening. This is going to be passive intervertebral motion for the lumbar spine, and we're going to be checking it for flexion and lateral flexion. So for flexion, what we are looking for is a gapping as we bring Brian through passive range of motion for hip flexion, and then what we're looking for during lateral flexion is we're looking for some closing of the vertebra as we bring him up. Now we are going to be testing this for bilateral for both sides as we perform this, just to make sure we have some symmetry and to check for motion. However, for now, we're just going to be doing it on this side. So to test flexion, we're going to have to support his legs, and I'm going to put myself in a staggered position so that my knee can help support as I'm bringing him through this motion. Next up, we're going to be looking for L5, and we're going to be placing our finger between the L5 S1 joint and moving our way up to feel each vertebral movement. So as I'm doing this, I'm checking to feel the motion between each vertebra, and as I'm bringing him through it, I can feel that there is gapping with each vertebra. Great. So this time, we're going to be dealing with lateral flexion, and to do that, once again, we're going to need a little bit of support from our knee with a staggered position. And instead, we're going to be tilting him upwards. Same thing, we want to look for the spacing between the vertebral joints and see how they move as we bring him through lateral flexion. So I feel that there is gapping or closure between the vertebra as I'm putting him through this, which is a normal expected pattern. That's it. So please stay in tune for more videos. We've got a lot more lessons, a lot more videos to share with you guys. It's been great having you. That's it for now. Ryan signing out. See ya.